So we're here today to discuss snoring and sleep apnea. And snoring is always funny to people because they see their husband, their wife, their children, and of course the husband never admits to it and the wife never admits to it. But the children say, we're down the hallway and mom and dad keeps waking us up throughout the night and we have to run into their room and wake them up. So snoring is really no laughing matter, and nor is sleep apnea. Sleep apnea is the #1 cause of heart attack and stroke in men and women over 50. It does lead to irritability and dysfunction at work and at school for both adults and children do snore and children do have sleep apnea, which means snoring is when you make those loud noises that we all laugh at, which aren't really that funny because they do cause significant problems for the patient suffering. And sleep apnea is where they stop breathing and then wake up by, even though they don't realize that they wake up, what's happening is they're not breathing, their oxygen levels to their brain and their heart are decreasing. And in people with heart conditions or people that are over the age of 50, they have increased risk of stroke and heart attack. And so for those reasons, it's really, really important to take care of snoring and sleep apnea. We also know that as your oxygen saturations drop, whether it's snoring or sleep apnea, you don't get the right amount of sleep at night and you wake up and you're irritable and you're cranky and you're not performing well at work, you're not performing well at school, you may be acting out as a child. Parents may not realize why the child's acting out. It may be that he's snoring and not sleeping properly, and so he's exhausted. And so addressing these problems are key to getting a good quality of life. Now what we do know is snoring and sleep apnea are connected to chronic sinusitis, allergies, snoring, sleep apnea, gastroesophageal reflux disease, and we coined the term CAID, chronic airway digestive inflammatory disease. If you have a blockage from anywhere from the tip of your nose to the back of your throat, that can cause you to snore and or cause you to have sleep apnea. And those blockages need to be addressed. Now patients come in all the time and go, I want that snoring operation I heard on the news or my friend had. Well, snoring and sleep apnea are caused by various different problems, and there's not one operation to resolve it. There's medical therapy that may resolve some of the blockages, and if those don't resolve the snoring and sleep apnea, then you may resort to a multitude of different types of surgery to address your specific problem. And you may not have the same problem that your husband has, your wife has, your friend or your cousin has. So they may have needed a nasal surgery, let's say for a septal deviation. You may need a palate surgery, or you may need a tongue surgery, or you may need medicine for your allergies. Everybody's different. So you don't really want the latest and greatest surgery. What you want is the right surgery for you. You want to go to a specialist that specializes in sinus, nasal, and snoring and sleep apnea problems so they can address you, diagnose you accurately, and then after they make an accurate diagnosis, treat you properly to get to your problem. A lot of patients come in, they had the snoring surgery, so they thought. It didn't address the problem that they had. It addressed maybe one of 3 problems that they had, or maybe it addressed none of the problems that they had, or maybe it addressed one of the 2 problems that they have. But until you address all the blockages on that pathway, you're not breathing correctly. So an accurate diagnosis, then targeted treatment, both medically and possibly surgery, are needed. The good news is for most of these procedures that we do today, there's no general anesthesia required. You're in and out of the hospital in the same day, no packing, no black and blues, and most patients don't need pain medicines because there's minimal discomfort. Thank you very much. If you have snoring and sleep apnea, you really should get to have someone diagnose you properly.